Hello everyone, hope you're doing well. I'm not going to take a long time, of course, in this video because we've already had a few that you've looked at today. And these slides are only about 20 slides long. So wanted just to make sure that you went over and understood the material in this, of course, week's chapter, chapter 4. Of course, our 6th edition of Medical Law and Ethics. You can go over the learning objectives, but there's a lot of differences in today's healthcare environment, and the problem is you can record one of these lectures every year because things change. There's different payers. There's fixed payment plans with medical care with a monthly fee usually tied to Medicare and Medicaid, but there's fixed payments too based on contracts that you come up with for your healthcare settings with commercial payers as well. So, we've always talked about different things related to value-based care and fee-for-service, and we're moving towards a value-based care model. You should understand a little bit of that based on reading the chapter, but we're still not fully in a value-based system. Now, some states do this more than others, but fee-for-service is still the majority of care that's issued out there, especially in rural locations. But managed care, MCOs are out there, health maintenance organizations, so it's kind of a limited group of providers, usually at a capitated rate, and sometimes for healthcare, people with healthcare commercial insurance, it's a little bit cheaper than a preferred provider organization, which gives you a little bit more room to, of course, find a provider of your choice. And then exclusive combines kind of HMO, PPO services, and it's a fee-for-service model like we talked about earlier. But there's a lot of differences there from an exclusive provider organization. I don't see that very often. I usually see PPOs and HMOs the majority of the time. All right. Some federal assistance programs. I know a lot of you have talked about and heard about Medicare. Of course, that's for the disabled, elderly, and a lot of people when you transition from retirement to from working to retirement, they transition into Medicare, and it's been around for quite a while. I think it's 1965 is the exact date. And then DRGs are how people or hospitals get paid based on Medicare payment via illness, all right? And that could be determined in a variety of factors, but that's from a hospital setting, right? We use HCC codes on the clinic ambulatory side to determine complexity, and that's how we're reimbursed on an ambulatory side. Medicaid's a joint federal and state system where the federal program is implemented by individual states. Of course, it's assistance to those needing coverage that can't afford it, and also those that have specific personal challenges related to maybe kidney disease or something similar. All right. Here's some ethical considerations of managed care you could take a look at. Just very basic stuff that we've looked at a few times in the past, and you've probably read in this week's chapter. Quality Improvement Act of 1986 is something else that you should be aware of. It was passed because of medical malpractice concerns and protects whistleblowers from going public, of course, when there's issues. And then it also created the National Practitioner Data Bank. But that information, of course, is not disclosed to the general public, but gives a background there. It's not something that I think will be a test question. It might come up in a quiz or an assignment, but don't stress about knowing the details of that. And then here's some types of medical practice. You can have a solo practice, a partnership, an associate practice, a group practice, or a professional corporation. The majority of what you see out there are group practices, and most service lines have that. There are solo practices out there and partnerships, but the majority that you're going to see is group practice. It's a lot easier to do call as an example that way, and just to cover patients, it's hard to go solo or have two providers in one setting, depending on the specialty. And then fee splitting, I don't really want you to dig into this too much, but it's when one physician offers to pay another for a referral. That's unethical and illegal. It happens at times, but we put a stop to that from a state and federal level. And then you have franchises and franchisee information here that you can take a look at. Not something that I expect you to understand or know at this juncture of the course, but it's something that's discussed in this chapter. And then medical specialty boards. There are 23 specialty boards that improve the quality of care across the board. Family practice has one, cardiology has one, and there's board certifications for those specialties. Make sure you understand what that is. Internal medicine has their own hospitalist program. I'm pretty sure has one. There's a variety of different ones out there. So make sure you understand. You don't have to know the unique ones, but you just need to know what specialty boards are and what their existence is for. Here's some examples: American College of Surgeons and American College of Physicians, FACP, FACS. A lot of people, like I have surgery practices under my leadership structure now, and a lot of them, of course, they're all certified through the Fellow of American College of Surgeons, which is great. It's a lengthy process to go through those tests. It's not something that's easy. You don't just sign up and pass based on your education. You have to, do CEUs or it's not CEUs at that level. It's actually called CME, and you have to, of course, take a test. All right. Here's some healthcare professional, allied health professional licensures. So nurses are licensed, nurse practitioners are as well, and they're going to have varying ability depending on the state. LPNs are licensed, and then pharmacists. Oops, go down here. Certified professionals include physician's assistants, medical assistants, transcriptionists are certified, lab techs, and lab technologists. All right. And there's also registration. So you have licensed nurse and a registered nurse. It's pretty much you have to have, they're both. And then medical assistants are also registered as well. But most of the medical assistants you see out there nowadays are MACs, certified medical assistants. There are MARs out there. They're kind of rare. But we're moving towards more of an MAC model. At least my organization is. I know a lot of organizations are as well. Some MAs in different states have varying levels of requirements. Some MAs, like in the state of Alaska, can report up and through the actual provider's license. I'm not sure if that's changed, but we had more MARs up there. So something that was pretty interesting and different to see based on the state that you live in. All right. You don't have to know a lot of these details, but just understand there's differences between like registered, certified, and different professional levels. All right, conscience clause, last thing. It's enacted by several states, and employees sometimes have a moral or religious objection to assisting with certain things, like sterilization or abortion might be an example. And you can't discriminate based on like religious preference for an employee if they, of course, ahead of time. I think you have to do it ahead of time. I don't think you can do it in the moment. You might be able to, if you don't understand what's going to happen in the future, but ahead of time, if they say, "Hey, I don't want to be a part of this. It's against my, my beliefs, my morals, my values," then the employer cannot hold the employee accountable unless there's patient abandonment or something else that really dives into something deeper there. All right. That's all that we're going to go over in this chapter. There's not a lot here. It's a shorter chapter, but you have a bunch of different videos that I think are really going to lead up to this. And based on my understanding of chapter 4, there's a lot of great information. But make sure that you understand the basics so you can move forward. And if you have any questions, don't ever hesitate to reach out. I'm happy to help. Thanks so much.